Hello, I'm Peter Ndora and welcome to this week's edition of Health Talk. Now, today's day 111. Can you believe it? Yeah, 111th day of South Africa's national lockdown and day 45 at level 3, all in response, of course, to the COVID-19 global pandemic. So what's coming up on the program today? Well, we'll be joined by the board chairperson of the South African Medical Association, SAMA, and also a member of the Ministerial Advisory Committee, the MAC, to speak to us all about the state of readiness of South Africa's hospitals. We'll also be speaking to a young woman living with an anxiety disorder. And this is particularly important as we in the midst of COVID-19. A little bit later on, we'll be speaking to a clinical psychologist who'll tell us a little bit more about the medical side of anxiety disorders and how to cope with it during COVID-19. That's all still to come on a packed program. But first, let's catch up with our senior producer, Zama Buthelezi, who'll be taking us through the latest South African COVID-19 numbers. Good morning, Zama. I hope you're well. Shocking, the figures, they're just rising.
A very good morning to you, Peter.
South Africa is now number 7 in the world when it comes to COVID-19 infections, but the country's death toll is still low compared to most European nations where epicenters. Examples of these are the United Kingdom, with more than 290,000 infections, recording more than 45,000 COVID-19 deaths. Spain, with more than 250,000 infections, recording more than 28,000 COVID-19 deaths. The World Health Organization is reviewing new evidence on whether the coronavirus can spread through particles in the air. Let's listen to the organization.
We have been talking about the possibility of airborne transmission and aerosol transmission as one of the modes of transmission of COVID-19. We're also looking at the possible role of airborne transmission in other settings, particularly closed settings where you have poor ventilation. And we've engaged with a large number of groups, epidemiologists and clinicians, IPC specialists, engineers, mathematical modelers, to try to consolidate the growing knowledge around transmission.
When you're in an emergency situation like we are, and when the science is constantly changing on a daily basis almost, we review some days up to 1,000 publications. The average is about 500 new publications a day. So there's a huge amount of new data that's being put out. Not all of it is of good quality. And so we do what's called a living systematic review. Every week we update the review based on the latest. And there are hundreds of publications now in the area of transmission. We take this very seriously. We are, of course, focused on public health guidance. And so any guidance that we put out has implications, of course, for billions of people around the world. So it has to be carefully considered.
In South Africa, more than 2 million people have tested for COVID-19. More than 300,000 people tested positive. And sadly, more than 4,500 people have since passed on from the COVID-related illnesses.
While the country remains on level 3 of the lockdown regulations, not adhering to regulations and taking precautionary measures in South Africa have seen drastic steps taken to curb the virus. These include the alcohol ban, curfew between 9 p.m. and 4 a.m. and the mandatory wearing of masks. Let's listen to President Cyril Ramaphosa talking about reckless behavior during COVID-19 regulations that has seen a rise in numbers of infections.
In the midst of our national effort to fight against this virus, there are a number of people who have taken to organizing parties, who have drinking sprees, and some who walk around in crowded spaces without the protection of masks. Then there are some of our people who see no problem attending funerals where the number of the people in attendance exceed the number of 50 that has been set out in regulations. In some cases, some people go to funerals where more than 1,000 people are in attendance. This is how the virus is spread, through carelessness and through recklessness. It is concerning that many are downplaying the seriousness of this virus, despite all evidence to the contrary and what we have cautioned about on numerous occasions. We now know of several tragic instances where people who have organized or attended social gatherings, including what people call after tears, after funerals, including gatherings with family, have contracted the virus and have died. In the midst of such a pandemic, getting into a taxi without a face mask, gathering to meet friends, attending parties, or even visiting family can too easily spread the virus and cost lives. This may be a disease that is caused by a virus, but it is spread by human conduct and human behavior.
The Gauteng province is now number 1 in the country, having reached the 100,000 mark on infections. And more than 800 people have sadly passed on from the virus. Let's listen to the provincial update of the province by MEC Dr. Bandile Masuku.
Today we'd like to start by indicating and also expressing our well wishes to the Premier of Gauteng and also the Premier of Northwest and the Premier of Western Cape, who have this week have tested positive for COVID. We hope that the 14 days that they will endure with all the symptoms, they will be able to flow through and survive and be able to recover and come back to lead us in the fight against the pandemic. There is no hotspot in Gauteng. Gauteng is a hotspot as a province, because we have been saying to yourselves as the public that the manner that Gauteng is compact and interconnected, it's going to be difficult for us to separate the province and divide it into different districts and approach it in different districts. So what we are saying is that we are approaching Gauteng, all of it, because all of the districts, all the sub-districts, we have demonstrated to you that there are very few sub-districts. Actually, there's no sub-district in Gauteng that doesn't have an active cases. So that's one thing that is important. So all of us must just, wherever we are, whether we are in Mrafong, in Wedela, whether we are in Bronkhorstspruit, in Tshwane, whether we are in Hammanskraal, all the areas in Gauteng are regarded as hotspot because of the number of active cases. So we treat Gauteng as a hotspot, and when we move from one level to another, we are going to be moving as a province, not only as particular sub-districts.
We are by now all familiar with what we need to do to protect ourselves and others from infection. We need to wear a cloth mask that covers our nose and mouth whenever we leave home. We must continue to regularly wash our hands with soap and water or sanitizer. We must continue to clean and sanitize all surfaces in public spaces. Most importantly, we must keep a safe distance of at least 2 meters from other people. There is now emerging evidence that the virus may also be carried in tiny particles in the air in places that are crowded, closed, or have poor air circulation. For this reason, we must immediately improve the indoor environment and public spaces where the risk of infection is greatest. If you believe there is a chance you may be infected, call ahead to seek medical help from your healthcare provider or use the public hotline 0800 029 999 and alert them to your symptoms. Thank you, and back to you, Peter.
Zama, thanks very much indeed. Yeah, those statistics are quite telling, aren't they?
Definitely.
All right, let's carry on. But remember that as we observe and report on these COVID-19 cases, those numbers actually can change, and sometimes significantly, as you've been seeing. So please bear that in mind. Now, remember, you can also be part of the show, asking our various guests some questions that you might have on your mind, or perhaps you just want to share something that we'll be discussing. And the number to call is 011 714 5861 or 5877. That's Johannesburg 011 714 5861 or 5877. We'd love to hear from you. This is an interactive program and we want you to get involved. Now, the coronavirus storm has arrived in South Africa. Gauteng province is the new epicenter of the country's outbreak. Health Minister Dr. Willem Kize said that this past week, the hospital beds in all provinces could be full within a month. In addition to the bed shortage, many hospitals are grappling with limited oxygen supplies to treat patients with COVID-19 respiratory disease. Well, so that brings us to our question of the week, and this is it. What has been your experience, if you've had one, accessing a hospital in South Africa for COVID-19 treatment, or accessing hospitals generally, actually, I would say? You can send us your voice notes or your video messages on our WhatsApp number, and that number is 065 862 4548. That's 065 862 4548. If you're outside the country, +27 is the code to put in front of that number. And please try and keep your messages short, under 30 seconds if you can. That way we can get through many of your messages. And you can also catch us on social media, of course, via Twitter using our hashtag @SABC Health Talk or hashtag SABC Health Talk. And we're also on Facebook, and the Facebook name, SABC Health Talk. Okay, Health Talk continues right after this break. Stay with us.
The sale, the dispensing, and the distribution of alcohol will be suspended with immediate effect. A curfew will be put in place between the hours of 9 p.m. and 4 a.m. The wearing of cloth masks will be mandatory.
Welcome back. You're still watching Health Talk. Now, as the numbers of COVID-19 infections increase at alarming rates, especially in provinces with big metros, reports of overwhelmed health systems and burnt out health workers, as well as frustrated patients who've to wait for hours to receive medical assistance, continue to flood the media. As the country prepares for the peak of COVID-19 pandemic, how prepared are these facilities for the projected numbers? Well, we're hoping to get on the line in a few moments' time to discuss the state of public and private health facilities. Dr. Angeline Coetzee, she's the board chairperson of the South African Medical Association and also a member of the Ministerial Advisory Committee. And we're trying to get her on the line as we speak. But remember, you can be part of this conversation. All we want you to do is give us a call. The number to give us a call on is 011 714 6841 or 011 714 6842. That's the number to call if you want to be part of this question. Perhaps you might have questions. And the big question that we have for today is what has been your experience accessing the hospitals in South Africa during this COVID-19 pandemic? Has it been exceptionally difficult? I mean, I think before all of this COVID-19, particularly public hospitals, they've been under strain anyway. But has this been made worse? Well, let us know. We'd love to hear your thoughts and your experiences. As I said, we're going to get Dr. Coetzee on the line just now. But first, here's a tip from Dr. Marlin Mackay, who's been answering some of the most commonly asked questions relating to COVID-19. Let's take a listen to the most related questions this week.
Is it okay for me to visit my parents' family even if I work from home? No, it is not okay. The restrictions state very, very clearly there are no socializing at home. And I can't state this more clearly and more robustly. I have patients who are in ICU, grandparents, older patients who have never left home but are ill and severely ill, critically ill. Why? Because someone in the family was missing them and someone came to visit them. Please do not, under any circumstances, be visiting, especially if you are working, especially if you are up and down to the shop, to the chemist. You could well be carrying the virus without knowing it. We're talking about asymptomatic infections. So please make sure that you protect the elderly and protect those who are safely at home.
All right, so that's a very, very important tip, and I've got to say that a lot of people seem to be quite relaxed about that one. And the other thing that I'm seeing quite a lot of is actually within complexes. People seem to think that because you're in a complex that you can move around into each other's houses and also gather without masks. Please be careful. We are now the 9th highest country in the world in terms of infections. We overtook the United Kingdom yesterday, so it's a pretty serious problem that we have. And the real truth is that if we wear our masks, follow the regulations, we can manage this pandemic very quickly. All right, we'll be back straight after this break. Stay with us. Still lots more to come right here on Health Talk.
There are those who save money on their car insurance with Outsurance and those who haven't yet. If you're one of them and they can't save you money, ask them for 500 Rand. But if you've been with the same insurer and claim-free for 3 years, tell them you want a massive 1,500 Rand. Savings or cash, you always get something out. SMS card to 44211 or call 08600 60,000 for a quote.
Right, welcome back. You're still watching Health Talk. So, we were talking about the state of readiness of our South African hospitals as we approach the peak of the COVID-19 pandemic. And to help us assess the state of readiness, we're now joined by Dr. Angelique Kutzer, who's the board chairperson of the South African Medical Association, SAMA, and she's also a member of the Ministerial Advisory Committee. Thank you so much indeed for joining us and welcome to the program.
Thank you, Peter, and it's a pleasure and a good morning to all the listeners and viewers out there.
All right, so you work with doctors who are on the front line every single day, so you have a good sense of perhaps what they're seeing. And I just wonder, do we know the state of our health system at this stage as we slowly get towards the peak of this pandemic?
Well, the state of our health system is currently the same that if it was a person, you would have put it into ICU, meaning that the state of our health care is really in trouble currently. It struggles to handle the pressures of the pandemic, especially in the public sector hospitals. But don't forget one moment don't think for one moment that everything in the private sector is also fine and good and working. Everywhere it's a struggle, but especially in the public sector.
So what are your doctors seeing every single day? I saw a very disturbing article in the City Press last weekend, and the headline was, "Doctors are having to choose who lives." Have we gotten to that stage already?
In certain of the hospitals where there's not enough oxygen ports for high flow nasal oxygen, or there's not enough ventilators, or not enough healthcare workers who knows how to operate a ventilator, and there's no other beds in certain vicinities available, then you as a doctor unfortunately need to make the call whether who am I going to put on a ventilator if there's one that's working, who will be the person. And the person that you unfortunately would need to choose will be someone who has a greater chance of survival. And so there's criteria out there that's by the Critical Care Society of South Africa that explain in detail how do you manage and how to use that criteria on patients if you have them and you are sitting in this dilemma.
All right, so we're talking about facilities, we're talking about equipment, but I've also seen that around 400 doctors and around 2,500 nurses have been infected. And I just wonder if we have enough staff, given all of these people on the front line are falling ill.
No, we do not have enough staff. Remember, for the past few years, there was a moratorium put on all new posts or vacant posts in all the public hospitals across the country. So now, it's never been lifted. And it was always the lack of money was always the excuse. So now it's a few years later. Corona is here. We are seeing pandemics. And we have a skeleton of people under resources in our hospitals. And these healthcare workers themselves, the nursing staff as well as the doctors, are getting sick. The other sad part is you can get COVID more than once. So the burden is extremely high and intensive on these healthcare workers, especially again in the public sector, but also in the private sector, in the ICUs of hospitals that is having an increase of these sick patients. I think it's also important to understand that you can have 3 extremely sick patients in an ICU, and that 3 patients can keep you busy and can keep you awake for quite some time during the day. And the emotional burden on the staff and the doctors for caring for those few patients, not even to speak about if that ward is more than 100% full, is enormous. And there is currently no relief of those doctors or nursing staff to say, yes, let's see how we can manage and come up with a proper plan in dealing with overworked and exhausted doctors.
What you're describing, overworked, exhausted doctors who are seeing their colleagues getting infected and falling ill, is sort of a recipe for burnout. Is this something that you're experiencing?
Yeah, it's burnout, but it's not only burnout. It's going to lead to PTSD and major depression. And those doctors and nursing staff suffering from this will unfortunately take it back home. So it's going to have an impact on their family life as well going forward. And we should have anticipated. They should, while we are now in the midst of a crisis, how can we fix it? It is extremely difficult to fix it in the middle of a crisis. It's the same with the problem with the alcohol-related trauma that we are seeing. It's secondary to a much deeper underlying socioeconomic problem that's never been addressed. We have hospital managers that only tell, or just simply tell the young doctors, especially the interns, we are getting those complaints from SAMA now, especially since last week that we have opened up a whistleblower portal. We are getting these complaints. And that hospital managers just simply say to the younger doctors, you have to work, there's no one else. So carry on working. You cannot do that. This is a very emotional time. It's burnout is going to be the least of our problems going forward. And we are now going into the peak, the eye of the storm, as we like to call it. We are not yet into, especially in Gauteng and in the Eastern Cape, but the wheels are already falling off the bus.
I'm very worried about the doctors, the nurses, and support staff because what you're describing is, we're really now been working at full throttle and the engine is about to burst. What does that portend for perhaps the care that patients might get? Is this where we start to perhaps see mistakes?
The care of these patients is deteriorating, because if there's not enough healthcare workers, or doctors, you end up in the end that the few people who needs to look after the patient or the health of that patient from a medical point of view then ends up doing the linen, ends up throwing out the dustbin, end up doing a lot of work that's not in their job description, but just to make it work. And this is one of the other things that is been a characteristic of our healthcare workers, especially the doctors and the senior nursing staff. Over the years, they kept afloat a ship by with the minimum that they have. They always say, we just do it. And because they have learned that to complain about the inefficiencies in the system fell on deaf ears. So now we are now with the coronavirus epidemic or the COVID epidemic. Now you cannot just do it anymore. You cannot do the bush medicine anymore because this virus doesn't allow you to do that. And that's why we're saying the wheels are falling off. And what is also alarming is these pictures that you see of the minister going to a hospital and everything looks so nice in that hospital because they are aware that he's coming. They fix the hospital. They make sure that it is fine. So if the minister will go unannounced into a hospital or a clinic facility, it will be a total difference. That's
Doctor, I just wanted to ask, are people who don't need to come to hospital overwhelming the system as well? I think everybody's obviously worried with their own health and they'd rather go and get checked out and so on and so forth. Are we perhaps overdoing it and that maybe we should be staying at home until we get to various serious symptomatic stages?
Yes, you don't need to go to the hospital. That's why in the beginning, when you think you are sick, that's why there are clinics or private healthcare practitioners out there. We tend not to make use, especially from the private sector, to make use of the GPs out there to say, no, it's okay, it's only a normal flu, or it is only a cold that you're having or a sinusitis. So by going to the hospital, and on top of going to the hospital, you bring your whole family with. We have complaints, especially in Dora and Singinti Hospital, I think it is in Port Elizabeth, where the doctors are complaining that in the casualty in themselves, there's not enough space. There's less than 1.5 meter space allowed for them to be with the patient. So there is no space. There's no windows. And on top of it, the family of the patient is coming also into the casualties. Families need to understand that if your loved one is going into the casualty, worrying whether it's got flu, whether it's got COVID, whatever, please do not accompany. There should be guards at the entrances of these facilities and only allowing the patient to go in. You are putting your life in danger if you're not sick by going as a family to casualty. And I know this is part of our culture in South Africa, but it needs to change. And then we also have what we call the worried well patient. It's the patient that think I've got COVID and insisting that you need to do something for them, because I think that's their right. And the more you try to explain, the less they are listening, and they think that you as a doctor is incapable of doing your work. So the message should go out there. Only if you're really sick and you haven't had time to visit the GP, or you can't access your clinic, then you go to a casualty. Otherwise, you stay away from that place.
All right. You know what? We're running out of time, but perhaps as a final question, you say the wheels are falling off, but is there anything that we can do to try and keep the bolts on the wheels as we get to this pandemic? Because clearly, if we're not coping now, it's going to be worse in a few weeks' time.
Yeah. Unfortunately, healthcare has been politicized. And because it's so highly politicized, politicians and all these command centers and all the different layers of committees out there are hindering the advice and the care that should actually come from medical people on the ground, whether it's the GPs, primary healthcare, telling government how to address the problems in communities and how to do community medicine, whether it is in the hospitals. It should be clinicians, and it should not be run by politicians. And if we don't do this right, we're not going to win. Right. It's not a politician virus, it's a people's virus.
Dr. Coetzee, I hope the politicians are listening to you. Thank you so much indeed for your inputs, and we wish you and your doctors and medical staff the very best, particularly during this difficult time. Thanks so much indeed.
Thank you. I just want to say thank you to all the doctors and the healthcare workers out there putting their lives at risk, and their families that needs to cope with these doctors. Absolutely. And the healthcare workers.
You're so right. Our champions. Thank you so much, Dr. Angelique Coetzee. That's Dr. Coetzee, who's board chairperson at the South African Medical Association, SAMA, and also a member of the Ministerial Advisory Committee. And I get a sense we all need to fasten our seatbelts and do our bit. And if you can do your bit to make sure you don't have to end up in hospital, that is going to help us all. Wear your masks, wash your hands, sanitize your hands, sanitize surfaces, social distancing, stay at home. We'll have more for you in a short while. But first, a quick reminder of our question of the week. What's been your experience accessing hospitals in South Africa for COVID-19 treatment in particular? You can send us your voice notes at 065 862 4548. You can also share your thoughts with us on social media using our Twitter hashtag, which is at SABC Health Talk, hashtag SABC Health Talk. Okay, so we'll be back shortly. Stay with us.
Royal Tent is ready to serve the nation. We are the largest manufacturers of frame tents, event tents, medical tents, isolation field hospitals, portable toilets, water tanks, VIP toilets, and mobile cold rooms. In this time of national crisis, we at Royal Tent are ready to offer the best disaster management solutions. Buy direct from the manufacturer. Royal Tent, world's best tents.
welcome back. You're still watching Health Talk. Now, anxiety is a normal human emotion that everyone experiences at one time or another. For instance, when we're faced with a problem at work or before taking a test or maybe making a big decision. Well, anxiety disorders, though, are a little different. The distress they can cause is sometimes quite great, and it can interfere with a person's ability to lead a normal life. Roberta Negri from Edenvale in Johannesburg was diagnosed 20 years ago with anxiety disorders, and she's since recovered from it. But due to recent events, she's found herself back into depression and anxiety. And as part of her recovery, Roberta has now devoted her life to advocating for people living with mental illnesses, particularly anxiety disorder, through SADAG and her own support group. She joins us now to share her story. Thank you so much for joining us, Roberta. Welcome to the program.
Thank you, Peter. I'm happy to be on the show, and hello to everyone and all the listeners out there.
All right, so 20 years ago, that's when you were first diagnosed. And I guess it's a difficult one, isn't it? You know, when you break your arm, you can get an x-ray done and you can see that it's broken and they put a cast. Mental health is a slightly different animal. And so when did you realize, actually, do you know what? This is more than just kind of normal anxiety. What does it feel like, and when do you know that you actually need to go get help?
Well, so 20 years ago, I had my first panic attack, and I didn't know what was happening to me. I thought I was dying. I was convincing myself I had a brain tumor. I went from doctors to doctors, and no one could tell me what was wrong with me. It actually became debilitating because I couldn't do anything. I couldn't go to work. I couldn't be around people. I was scared of everything. And I then went to a very old Italian doctor in Orange Grove who was still there at the time. And luckily, he diagnosed me with clinical depression and panic disorder. And I was admitted to Tara as an outpatient person. And I had a very good psychiatrist there who specialized in mental health, being panic disorder and clinical depression. And she got me right. She got me on medication and sort of educated me more on the illness, because it's such a horrible, debilitating illness to have. And I went for a lot of therapy, and then unfortunately it came back 20 years later. But mental illness is a physical illness. It's like someone who's got diabetes and needs to take insulin, and someone who's got cancer needs to go have chemotherapy. Mental illness is exactly the same. It's a physical illness that needs to be treated and needs to be medicated.
And I wonder, we hear about TB patients, for example, that once they start to feel better, they stop taking their medication. Is that the same danger for people with anxiety disorders? Once you're on medication, you should keep on it, even when you start to feel better.
100%, Peter. You cannot stop taking your medication unless your therapist, your doctor, your psychiatrist has instructed you to do so. But it's very, very important that you continue with the medication. Even if you're feeling better, please continue with your medication, because you can spiral back downwards. I'm on medication now, and I'm probably going to be on it for the rest of my life. But I'm okay with it, and it helps me function, it helps me focus, and it helps me live a normal life.
So what would your advice be to people perhaps who might be feeling a bit of anxiety, especially as COVID-19 kicks in and we're getting into this peak? We're seeing a lot of people stressed, anxious, nervous, worried.
So a bit of advice is, I know it's a horrible time we're going through, and I'm getting a lot of calls from people that are really battling through this time. I myself am battling. I was retrenched during the lockdown after 13 years. So I know what it feels like, but you know what, we've got to wake up every day. You've got to put your makeup on, put your aftershave on, have a shower, get dressed, get ready for the day, and realize that you're not alone. It's a natural emotion that we're all going through at the moment. Everybody, I'm sure, is feeling the same. We're uncertain of the future. We're not knowing what's going on, but you're not alone. There are support groups. I run a support group in Edenvale every Wednesday from 6 to 7:30 for people with mental illness. And it helps me a lot because I realize that I'm not alone. You need to get a very good support structure, whether it be family, friends. Don't be alone. If you feel that you're feeling anxious and you're alone, please rather get someone to come and have a cup of coffee with you, or whatever you can do. Just don't be alone, and just remember that you're not alone through this. We're all going through it. And if you feel that you're not, that you're spiraling down, please go and seek medical attention.
Roberta, very, very important talking to you and your thoughts. Thank you so much indeed. And we certainly wish you the best with your journey as well. Thanks so much.
Thank you, Peter. All the best.
Take care. All right, that's
you too. Thank you.
Roberta Negri, somebody who's living with anxiety disorders, saying get help. And you're not alone. A lot of people have gone through this, they've gotten treatment, and all you need to do is seek out the help that you need. All right, we'll be back right after this, and we'll be chatting. In fact, a quick repeat of our question again this week. What has been your experience of accessing, I can't get my words out today, accessing hospitals in South Africa, particularly during this COVID-19 pandemic? Send us your voice notes at 065 862 4548, and you can also share your thoughts with us on social media via Twitter at SABC Health Talk, hashtag SABC Health Talk. So, after the break, we'll be speaking to a clinical psychologist about anxiety disorders, the ones you've just been hearing, and how to cope with them during COVID-19. Stay with us. Welcome back. You're still watching Health Talk. We're going to carry on talking about anxiety disorders. Now, the most common mental illness in South Africa are mental disorders. 1 in 5 South Africans are affected by these debilitating illnesses each year, characterized by overwhelming worry and fear. Anxiety disorders can keep you from functioning in your normal life and can be quite disabling, as we were hearing from Roberta a little earlier on. Tormented by panic attacks often, obsessive thoughts, flashbacks, nightmares, or even countless frightening physical symptoms. Some people with anxiety disorders even become housebound. Well, to speak to us a little bit more about these anxiety disorders, we're now joined by clinical psychologist Naledi Mqhayi. Thanks so much indeed for joining us, and welcome to the program.
Good morning, Peter, and good morning to all our viewers.
All right, so these anxiety disorders, I get a sense that there's quite a spectrum of the type of disorders that one can experience. Talk to us about perhaps the most common ones that you see in your practice.
Okay, thank you, Peter. Thanks for having me. Anxiety disorders, like you're saying, is quite a spectrum of mood disorders. They fall under a category of mood because they alter the way a person feels. And the overriding feature of anxiety disorders is apprehension. People feel worried, they feel scared, and sometimes for a good reason, sometimes without really much threat into their lives. So it can be anything from a mild worriness to an excessive episode of having a panic attack, which literally makes your body to freeze. But amongst the whole spectrum of them, we find the most common that I have been exposed to, especially that are common in South Africa, it is the PTSD, which is called the post-traumatic stress disorder. And it depends on the term, the time frame of how long have the symptoms been persisting to be diagnosed as PTSD. Otherwise, in a short term, like now in the COVID situation, you'll find that there are no people who will be diagnosed with PTSD right now because COVID is just about 3 months old. But only after 6 months or so, if the symptoms persist, then it will start be PTSD. Otherwise, for now, we're just managing what we call chronic stress disorder. Because then if it's repeated stress, that makes one not to be able to cope with the symptoms of their own environment, then it is chronic and it is intense. We also have a quite number of people who have what we call general anxiety disorder. General anxiety disorder is just general panic, general fear of the unknown, the fear of devastation, the fear of bad things happening. So in this COVID, one would not say it's general because it is specific to a particular a disease or a particular catastrophe that is happening at this point in time. But if it's excessive, then it falls into a category of phobia. Phobia of infection, phobia of getting a corona, phobia of dying, then it's a specific fear that is excessive. And then again, we also see a lot of panic attacks. I've actually, in the past week, I think I've had about 3 clients that presented with panic attacks in my practice, where now people feel overwhelmed by anxiety, by fear, by the status quo. You listen to news, everybody's talking about the deaths and how people are getting infected left, right, and center, everybody knowing somebody who's infected. And as a result, their bodies, their mind cannot cope with the situation. And you find that they already had other conditions or other mental conditions, which are now exacerbated by the trauma that is happening. And I think those are the most common that we find that are more exposed to. The others we don't really see much, like the OCD, obsessive compulsive, a very rare anxiety situation, and it's not very predominant in South Africa.
I suppose for conditions such as post-traumatic stress disorder, the cause can be quite specific because they've had some stressor, some event or some thing that's taken them to that point. But some of these other disorders, do we know what causes them? And I suppose a lot of people also want to know, how do you treat them?
The causes, Peter, can be anything from genetical predisposition, meaning if you have parents that had a mental condition, whether it's anxiety or depression or even schizophrenia, chances are you are likely to carry the gene that is the pathology with you. But also the anxiety, especially the mood disorders, it's likely to be caused by other primary conditions. For instance, it is well known that anxiety goes together with depression most of the time. So people who have depression are predisposed to also present with anxiety issues. And then also other medical conditions like hyperthyroidism, your thyroid gland that sits under your throat. The thyroid gland, if it's overstimulated, it tends to have an overstimulation of the adrenaline, and as a result can predispose one to have excessive heightened awareness of things and getting scared. There are other conditions like lack of vitamin B12 is also known to cause such conditions. And then also other things that would exacerbate the fears or the apprehension would be drugs, either side effects of prescription drugs that are prescribed by a doctor, but as a side effect, they will make your heart to pace, they will make you scared, hypervigilant, or it could be coffee. Excessive caffeine can cause that. Illicit drugs like your crack, your ice, your cocaine, they are likely to do that. Your LSD, they are likely also to give you that heightened anxiety. But also other psychosocial stressors or abuse. You might find that a child who has grown up in certain environments that makes them to be scared and to have the fear because of the unknown or because of unpredictability of the situation they live in can also cause an anxious child. Even parenting, faulty parenting can also lead to anxiety in a child who will grow up now with an anxiety disorder as an adult. So it's an array of things that can really make one to be anxious.
All right, so we're in COVID-19 and we are stressing. How can we ease some of this so that we don't get into full-on panic attacks and other anxiety disorders?
You know, Peter, there's one thing that I've been saying to people I interact with, my clients, even on social networks, on my people, that what is most important at this time is that stay focused. Stay focused on your course of action. Don't get yourself over stimulated by information around. Yes, it's good to be updated on how things are happening, but the one thing that it's been preached throughout the media is don't over consume information about COVID. Have time off from news. Have time off from social media, especially when it's talking about devastating cases and all that. And again, it is important for you to keep a balanced lifestyle, meaning keep healthy, exercise as much as you can, eat healthy, have time to rest, because you're getting yourself focused, you're getting your state of well-being more in a situation where even if you do get contact with somebody with COVID or you get infection, you are in a good state to deal with it. Because as it said, eventually we might all have it. So get ready that even if you do have it, you are able to cope with it. It is not just about the body, feeding your body with the garlics and everything that everybody is advising, but also your mental state. How do you make sure that by the time I find myself having COVID or even losing people around me, I'm in a functional state where I can be able to function and to cope and to also support the people around me.
All right.
And also the positive thinking. Keep thinking positive. Consume more positive stuff. Think about helping others. Be more compassionate to people around you. Share more love. Be there for those who need you. And that will help you also to be in a good place, not to be overwhelmed.
And that's where we're going to have to leave it. I'm going to show you some love and give you a virtual hug. Thanks so much indeed for that good chat. Thank you so much indeed. All the best. All right, that's clinical psychologist Naledi Mqai telling us to be positive. Thanks so much indeed for joining us on the program. Thanks to all of our guests today. You've been watching Health Talk. Join us again at the same week next time. Take care of each other. Wash your hands. Social distance. Sanitize. Stay at home. Be safe, everyone. Have a good week. Bye-bye.